The medicine in the Civil War was usually toxic. The common medicine was calomel, which had mercury in it. Because of this, it caused mercury poisoning, and it also depleted the body of important fluids. Doctors would also bleed the patient, which would make the patient weaker. Anesthesia was dangerous as well. They would use brandy, laudanum, and chloroform. Chloroform caused different stages to occur. The first was excitement imbalance, and the second was unconsciousness, being insensible, and having relaxed muscles. If the patient had to wait more than 24 hours after being wounded, the anesthesia was not used at all. The Confederates didn't always have anesthesia, while the Union had it and used it over 80,000 times. Sometimes ether was used as an anesthesia too. Little anesthesia mixed with bad wounds, no proper equipment, and no understanding led to the horrid surgery of the Civil War. The ambulances that were used to deliver patients were scarce, and the ride itself could make the patient in worse condition. The surgeons did not understand germs, so there were no sterile operating tables, tools, or water. 94% of the wounds were from bullets, and many tools were used during surgery. Each operating surgeon had 3 assistants, yet many surgeons did not see living organs, major amputations, or gunshot wounds before the Civil War. More and more surgeons appeared during the Civil War, with 12,000 surgeons in the Union and 3,200 surgeons in the Confederacy. During surgery, it was common to have amputations. Amputations were sometimes the only option, and many amputated limbs would pile up on either side of the hospital. Amputations of the extremities, which are hands, arms, feet, and legs, could save lives if they were done in the first 24 hours of being wounded. The field surgeons were known as amputation specialists, yet half of the soldiers being amputated died after surgery. Infections caused 2 out of 3 wounded soldiers to have compound fractures. Surgeons also tried excision, which is where they remove part of the bone, yet it shortened the limb. The surgery for an excision is longer than a surgery for an amputation, thus increasing the anesthesia rate. The mortality rate of the excisions was lower than the mortality rate of the amputations. Amputations and excisions both put the patient at a risk. The pain a soldier felt was unendurable, especially with no anesthesia. Surgery was done with a dirty table, dirty tools, and dirty water. The medicine and anesthesia were venomous and dangerous. This was medicine and surgery during the Civil War.